The robotic technology that we're using now is the leading technology available for joint replacement today. What's magical about robotic technology is that you can do the operation virtually before you do it actually. We obtain a detailed three-dimensional mapping of the joint, and then we can use that three-dimensional map to predict where the best positioning is for the joint components.
When we use the robotic technology, it does allow us to execute that plan with almost exactness, with precision within a half a millimeter to a half a degree. It allows us to preserve as much bone as possible and put those cuts exactly where we want them to be.
We can balance the ligaments perfectly intraoperatively and also carry out a plan to within a half a degree of accuracy to give them the best chance of having a straight leg that is balanced and stable throughout motion in all their activities.
Many patients wonder if the robot is actually doing the surgery, and that's not the case. It still takes a very skilled surgeon to perform the surgery. And the robot itself has a robotic arm where instruments can attach to the end of it, such as a saw, and it comes in and can assist in the surgery.
For hip replacements, it's also helped us to improve the accuracy and the reproducibility of where we position the cup so that dislocation rates are lower, and also helps us to improve the accuracy of leg length determination intraoperatively.
We're able to trust the robot to be as precise as the machine can be, sometimes even more precise than human hands.
It's seemed like my patients have recovered quicker, had better range of motion quicker, and have just seemed to have had less pain as well.
I think patients are pleased to know that we're using the most up-to-date technology to give them a knee replacement that should be lasting and very functional for a lot of years.